The latest death toll from Ebola outbreak in the DRC is 56 people, with at least 64 cases confirmed in North Kivu. Well, Doctors Without Borders is among the healthcare professionals working with the DRC government to curb the Ebola outbreak. Earlier, we spoke to Karin Huster, an MSF emergency coordinator, about the organization's efforts on the ground.
The epidemic was started on August 1st. We had some teams that were in the surrounding area of North Kivu that intervened right away. They were not Ebola specialists, but they were able to come to Mangina, where the suspect cases were, and they helped the staff of the Ministry of Health to secure the area where they were working and where the cases were. So they improved the biosafety of the area, and at the same time they started to build an Ebola treatment center, which was completed on August 14th. And that same time we transferred all the patients from that isolation center, which was really, inside of a health structure, and we transferred those patients into the Ebola treatment center, where they now are. So now the teams are working in close collaboration with the Congolese Ministry of Health staff, and in order to treat all the patients that we receive. So that's the first sort of pillar, case management of treatment of patients from hopefully the very beginning of their illness until their discharge back into their homes. We have a second pillar that we focus on, which is to ensure that the health structures in North Kivu that are not affected continue to function, so that the population can access them, and we make sure that we have trained the staff there, that we have protected the structures so that people who come who are suspects do not enter those health structures, and the care of the population can continue. So they can continue to access care like, malaria treatment, deliveries, and things along those lines. It was a big issue in West Africa when pretty much the health services collapsed entirely when everybody was focused on Ebola.